Now it's time for tip-episodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Welcome back, everyone, to another tip episode here on Tale of Two Hygienists podcast. I'm your host today, Andrew Johnston. And, a question came up recently. I was doing a coaching call, not me being the coach, but I was just helping a friend. And the question was about getting the patients to buy a very specific product. And I thought, man, this is something that we talk about a lot when I was a hygiene director, and I'd go into the offices and we'd have certain initiatives or certain situations where, patients needed a certain product and we were just really struggling in that office to get the patients to buy in. And so I was thinking, man, if we had those many problems before, and then there's obviously problems going on now, it's probably something people are running into quite a bit. And so we should probably make a tip episode about this. So I just jotted down, what is this? 1, 2, 3, 4, 5, 6 thoughts that I think can be applied for when you're trying to get your patients to, let's say that you're trying to get them to buy an electric toothbrush, or maybe you just need consent for fluoride treatment or periotherapy. I mean, even if it's within your responsibility to help them commit to doing restorative work, kind of whatever situation you're running into where you need a patient to do something or say yes to something, I'm hopeful that some of these tips will kind of help. Yeah, I don't know that all 6 of them are going to be specific to your needs, but hopefully, at least a couple of them. So here we go. Number 1 is, man, you just got to believe. This is a big one, because if you don't know, like deep inside your heart, that product works the way that it's supposed to, or the way that you're telling your patients to, man, that patient's going to sense it. They're going to know that you don't really believe in what you're saying. And maybe some people will just be like, oh yeah, just do whatever, I trust you. But there's still going to be a lot of patients who are going to say no, because they feel that there's just something off. So let me ask you a couple of questions just that you can kind of ask yourself and gauge your response. So when I say, does 1 + 1 = 2? How confident are you in that being a yes? Like, yes, of course, 1 + 1 = 2. Like, how do you know that? Like a bajillion %, right? Like, you know that to your very, very core. And how do you know this? Well, one, we're taught at an early age, right? It's repeated all the time. That's a very common phrase that we hear. But also, you've seen it, right? Like, you put one scaler in one hand and then another scaler in another hand. And because you can see it, that you have 2 scalers in your hand. Similarly, sometimes you need to test a product. Maybe you need to test it on a patient or yourself so that you can become a believer in that to the same degree. Like, you need to know. So if you believe, you should be good to go. But what happens if you just don't believe in the product or the procedure or whatever it is that you're talking about? I guess my question to you would be, why not? Like, why don't you believe in it? What I run into, it's mostly because they haven't seen it or felt it themselves. And so is that the same with you? Like, you haven't had a hands-on experience with this? Maybe you're questioning the research. Is the research solid? Have you even read the research by chance? Have you done any research beyond what the manufacturer gives you, or whatever the creator of the technique or whatever has given you? I guess my bigger question is, like, have you poured in the hours rather than just saying, no, this is dumb, or I don't like it, or I don't believe in it, that's stupid? Like, have you poured in the hours to know if this is true or not? Have you tracked the science? Have you sat through the courses? Have you asked all the questions that need to be answered? And if you haven't, then that's a good place to start. Okay, so number 2 is knowing the product inside and out. And this is more because, man, you're going to look foolish if you don't know the answers when someone asks you a question. The thing about this is there are so many things that do change, but they're subtle changes. Like, when was the last time you went through an ingredients list on Prophy Paste, on the one that you used? And is the one that you use now the one that you used 5 years ago? I mean, it may or may not. You just don't know, but are the ingredients the same? And if they're not, then what do the different ingredients do? That's an interesting one. I've been asked that several times. What about like the anesthetics that you use? Like, do you understand all of the allergy alerts or the sensitivity alerts, or all of the things that go with all of your anesthetics that you use. Sealant materials is an interesting one too, because they all have different rules. It used to be, and I don't know how, this is when I was taught, it used to be it was a chalky, dry surface before you applied your sealants. Then there was new technology that came up around, and you can have slightly wet surfaces. Now you can do it in pretty darn damp surfaces with certain sealant materials. Do you know which ones go for which? What about the ones that are light cure or self cure? Like, when was your last time that you updated yourself on the use of MI paste at home? And do you know which one is the best for whatever situation? I guess my whole point is, like, every product that you have that you're trying to get your patients to use, you should be able to answer any question that they might have about it. It's going to take a lot of time. It's just similar to like the other one where you have to believe in it. Like, it might take hours of research to understand these things, but you have to know the products inside out. If you don't, again, the patients are going to sense it. They're going to feel that you don't really know what you're talking about, and they're probably not going to do it. Number 3 is field questions professionally and also without being wishy-washy. So let's kind of give you an example for that one. You go to a car lot and you're looking at cars, and you found one that you really liked, but maybe you had a couple of reservations, not anything that's really big, but maybe something that would say, hey, maybe I'll do this next time I come in, or let me think about it for a little bit. Well, then here comes the salesman. They come out and you're able to address some of the things that are concerning you. Say, hey, what about this? What about that? How would you feel if that salesperson had just a blank look on their face when you ask those questions? Or they were like, yeah, I mean, it's pretty good. Or, yeah, it should be able to do the thing that you want it to do. I don't see why it wouldn't. I mean, you wouldn't feel super confident paying the money for that car with no clear answer or direction. And so it's similar here. Like, you can't be wishy-washy in your answers. Do sealants protect the teeth? Yes. Not, well, sometimes they do, sometimes they don't. Now, that's not a real good answer, right? Okay. Number 4, be honest. So at the same time with that salesperson, you don't want them saying anything that's just a bald-faced lie just to make the sale, right? You want them to be honest with you and tell you the truth about certain things. And so you need to be honest with your patients. And number 5, it kind of is along the same lines as number 4, where you need to be a real partner with your patients through honesty. Like, don't recommend a product or a service that the patients don't really need. If they need it to get them healthier, then do it. Your only job, literally, the reason that you have a job is to fight oral disease through either prevention or therapy. And a big component of that is getting your patient to help themselves when you aren't around. So if you're recommending products or services, you have to do it for the right reasons, because you love your patient and they're your partner in getting healthier. And number 6, the last one, is cost should not be a factor, but value should. Now, there's a kind of a caveat with this is we don't set our own fees, right? That comes with the practice. It comes with the doctors. One thing I will say about that is have clear conversations with your doctors about fees. Now, some things you can't mess with because you guys are under contract, and some things that you can. And so that is where, you need to talk to your doctor and say, hey, look, I know the patient base, you know the patient base. Where do we feel comfortable setting the price for this particular product or service? I've been telling the story about kind of my health journey over the last couple of months on the podcast. And, many of you know that I went and saw my endocrinologist this last week. And this was an appointment that was set up. It was in network, right? Through a referral system from my doctor to a specialist in network as well. All I had to do was fill out a few pieces of paper for the new office. They had most of my medical history already on my shared chart. So it was pretty minimal what I had to do. So I get to the office, I park the car and I go in, let them know that I'm there. I was there about 20 minutes or so early. So I have a seat in the waiting room. They were Johnny on the spot. They called me back pretty darn early. I wasn't there probably 5 minutes. They called me back. The nurse does, the height, the weight, the blood pressure, a few other little things on my chart, just updating some stuff. Less than probably 5 minutes. She walks out of the room, says, doctor will be here soon. Doctor was in within probably another 3 to 5 minutes as well. She came in, we talked maybe 10 minutes beginning to end. And we talked about my labs, what I had before, what ones we're going to order, what they mean, what medications could potentially be in my future, what that would do. And then I left. I didn't pay anything when I checked out. There was no discussion on how much any of this would cost me. I just knew that, hey, they're in network, so it'll be less expensive than someone that's out of network. Within 2 days, I had a bill sitting in my patient portal for around $250. And that was just to talk to someone for 10 minutes. Now, I could feel like I was taken advantage of. $250 is a lot for 10 minutes of a doctor's time. But I feel like I got my money's worth out of that conversation. I asked all of the questions that I wanted to. I had all of the discussions I wanted to. She gave me all the answers, or at least if we didn't have the answer, we had a pathway forward to find the answer that was very clear and made a lot of sense to me. But we never talked money. The value of that same scenario for someone else, they might feel like they were taken advantage of. They might not feel like they got their money's worth out of it. But for me, it was great. And I use that as an illustration because a couple of things. One, the value or the cost is a perception. You're never going to make everybody happy with setting a particular price point. It just doesn't happen. I mean, free is the best price point that everyone's going to love. But also the thing that I appreciated the most was that money did not dictate the level of care that I received from my doctor and their team. I needed that appointment. It was for my own good. The provider made sure I felt heard. She gave me insight into what was going on. The information had huge value for me. So how can you make sure the patients that you have see value in the $20 per month for the 5,000 ppm fluoride paste, or maybe $350 per quad for scaling root planing? So obviously there's too many scenarios to cover all of this in a tip episode of how to have each of one of these conversations. But the bigger picture is you just need to show value to the patient. If you're struggling with this aspect, the great thing is there's plenty of resources out there. Lots of really good coaches out there for hygienists specifically. They'll spend time with you, run down whatever of these specific scenarios you might have in your office. You can ask your fellow hygienists either on social media or at local meetings. You can ask your doctors. You know who's really good at this actually? Treatment plan coordinators. If you have one in your office or just someone in your office that's really good at helping the patient accept treatment, that's your ticket right there. They are really good at explaining the value proposition for this. And so you need to mimic what they do. The bigger thing is you're not alone in this, right? But you do have a personal responsibility to your patient to do more than a chat and polish with some quaint little saying of, hey, keep brushing and flossing, you're doing a great job, and then let them walk out the door. You owe them specific tailored care using specific techniques or equipment, in-office or home care products, all of those things. They need tailored care to them. Thank you so much for listening, everyone. If you have any questions or thoughts, Andrew at atale2hygienist.com. Wishing you all the best. Enjoy this weekend, and we will see you next week.
A tale of two hygienists.